Today we are doing Botox, and Botox is the #1 aesthetic procedure done in the world, and it paralyzes the muscles in your face for about 3 to 4 months. So a very popular place to treat is called the glabella or the 11s. You can also treat your forehead, you can do crow's feet. A couple other places you can do would be masseter muscles for grinding or for TMJ. You can treat hyperhidrosis or excessive sweating with doing some Botox in the armpit, hands, or feet. So there's lots of good reasons to try Botox, but we're gonna do just our basic Botox today, which is gonna be between our eyebrows and our forehead. So are you all set? Perfect. Okay, I'm gonna just balance here. And I'm gonna start over your left eyebrow. 1, 2, 3, here we go. And average dosing for this area is 20 units, but can be as high as 30 or 40 or even 50 units. So it just depends on how strong your muscles are. Men typically need a little bit more than women do, because these muscles are usually a little stronger in them. One in the middle here. All right. So that's how quick that treatment is, and we're going to go ahead and keep on going, and I'm going to do her forehead now. I'm going to go all the way over to the right forehead. 1, 2, 3. Good girl. Going to go up high. Excellent work. Come down a little lower. So if somebody has really heavy eyelids, I don't really recommend doing Botox in your forehead, because your forehead muscle is your only elevator muscle, and so if we treat your only elevator muscle and paralyze it, it can cause your eyes to be a little droopier. And that is not because it's not working right, it's because it is working really well. So I also like to explain when somebody, especially young people, come in and they have really deep lines here, I always look at their eyelids, because if your eyelids are real heavy, just for genetic reasons or whatnot, over time, in order to see, your eyebrow is lifting your eyelid. And what lifts your eyebrow? Your forehead muscle. So this muscle gets worked quite a bit when you have heavy eyelids, just so you can see. And you don't even know that you are lifting or using that muscle so much. So that's how come even younger people can get real deep lines up there. But that's my little education for today. But other areas, like I said, we could treat crow's feet. You can also treat these muscles down here. They're called the DAOs to help give a little lift. So lots of places we could do Botox. It's very, very safe. Side effects could be a little bruising, but that's about it. You know, people are always worried they're going to have anaphylaxis. They're not always worried. Sometimes people get nervous, but you really don't. I've never seen people have an allergic reaction to Botox. It only radiates out a quarter. So when we inject up here, it's not going to affect your shoulder. It's only going to affect that area right there. We're not getting it into the bloodstream. And even if we did, it takes 30,000 units of Botox to kill somebody. We just did 34 units. So 34, not 34,000, 34. So it's a very, very safe medication to use, and it's very, very pretty. And everybody here at Rejuvenation MD loves it, especially me. So if you want to learn more about Botox and if it's right for you, you can find us at RejuvenationMDmedspa.com.